as you'll be aware, today I'm going to be giving you a full medical examination. I'm going to be checking various body parts such as your face, your eyes, your ears, and your posture as well. There'll be lots of cranial nerve type tests, as well as some basic medical tests as well, just looking for any potential issues or problems, okay? Great. So please do be at ease. I'll make this as relaxing and calming for you as possible. So before we begin, I just need to ask you a few basic medical questions, okay? Great. So, are you currently taking any prescribed medications? Okay. Perfect. And have you visited a doctor within the last 6 months? Okay. Perfect. And do you suffer from any allergies at all? So just a bit of hay fever. Great, me too. And do you or your family suffer from any pre-existing health issues such as asthma or high blood pressure? Okay, great, thank you. Great. And finally, can I ask for your date of birth, just so we have it on our records? Okay, great. Ideal. Thank you for asking those questions so honestly. Now, before we begin, I just want to check your heartbeat and the beat of your lungs as well. Okay, great. So just stay still. Let's have a listen. And your lungs, just have a listen. Well, everything seems to be beating as it should be, which is very good. Okay, so I'm gonna begin these tests now. First off, I'm just going to put my gloves on, have a protective barrier. Okay. So first off, I'm just going to have a general look and feel around your face, just visually feeling, physically and visually feeling for any issues or anything which might need a bit more looking into, okay? Okay, so just relax. I'll be very, very gentle. Okay, so let's just start by looking along your jawline. Okay, perfect. Just having a very gentle feel around your face and just around your forehead. That's it, just relax. Okay. Perfect. Now, I'm just going to check your peripheral vision. What I'm going to do is move my hands into the center of your vision, and I just want you to tell me how many fingers I'm holding up, okay? Great. So just keep your eyes focused on the center. Correct. 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 Let's have a think. Correct. Correct. Perfect. Now, I just want to have a visual look around and inside your eyes with this light. The purpose of this is just to check how well your eyes respond to the light and if they're dilating correctly, and just to check if there's any issues with your tear ducts at all or anything like that, okay? Great, feel free to blink at any time, it's absolutely fine. You ready? Okay. Just that's it. should be. Your tear ducts are in good order. That's it. Just looking a bit. That's it. Great. I'm just going to swoop. From your peripheral into your center line of sight. And down. And down. And up. And down, down, down. Great. Now I'm gonna ask you just to keep your head still and just use your eyes to track and follow the light, okay? Okay, so let's just do some basic shapes and circles. Just keep your eyes focused on the light. We go. Absolutely great. You're doing very well. That's it. And the other way. That's it. And just from the sides. And down. And if I'm just going to go crossways, just and the other way. Thank you. Now I'm just going to very gently rest my hands just below your chin, and I'm going to tilt your head left and right, just very, very gently, just looking for any resistance or tension. Okay. Okay, so just tilting. And again. And again. to apply some very gentle pressure to the left side of your face and just gently. That's it. That's it. Great. And the other way. That's it. That's it. Great. Now, you don't usually see a brush in a doctor's office, but I'm going to use this to check the sensitivity of your face, your ears and your neck, just to see how well your nerve endings are responding to the gentle bristles of this brush. Okay, this will be relaxing, definitely. Okay. Just gently brushing. That's it. And there we go. There we go. That's it. That's it. Just brushing very gently. Just to see. Just to see how sensitive your face is. I'm just going to go down to your neck. You just feel a very light tickle across your neck. That's it. And your ears, they should feel very relaxing. Just up and down your ears. And just up and down your ears. Great. So now I'm going to be checking your posture. Posture is definitely often underlooked by a lot of people, but it's vitally important that we keep check of our posture and make sure we're doing everything possible to prevent any kind of problems with our back, our neck, or any area like that as we get older. Okay, so first off, if you don't mind, I just need you to turn around and walk towards that wall and back to me, okay? Great. Okay. Perfect. Now, I need you just to lift up both arms like this. That's it, and just try to keep them in position. I'm just going to have a feel along both arms, okay? Okay. suffer from any neck pain at all? Okay, and do you happen to sit down a lot during the day? Maybe because of your job or... Okay, good. I do recommend trying to sit upright and stand upright as much as you can. Just helps prevent any problems. Cool, now I'm going to be checking up and down your spine now, just checking for any spinal compression or anything which might need a bit of further attention, okay? If you could just turn around and bend forwards, lean forwards a bit like this. Great, I'm just gonna have a look down your spine. That's it. Okay. And just that's it. Okay, perfect. And now if you could just lean backwards a bit like this, that's it. You should maybe feel a bit of a strainy kind of feeling just on your lower back. Okay, I thought so. I'm just going to have a look. That's it. Just having a feel. Okay. You can turn around. Great, thank you. Now, what I need you to do is just gently cough for me. I'm going to turn my head away, but I'm just going to rest both hands on your chest area. Okay, are you ready? So just gently cough for me, please. Thank you. I'm just having a feel. Okay, if you can just gently cough for me again, please. Just feeling around your neck area. Okay. Great, thank you. So, you do have very good posture, which is good. I do like to recommend perhaps just doing some basic stretches at home, or maybe taking a yoga class, just something to help keep you nimble and agile and help prevent any possible strains or injuries, okay? Great, so now I'm going to be checking both of your ears and your hearing as well. I'm going to be using this octoscope just to look inside both ears, okay? Great. This should not feel comfortable, but please do let me know if you do find it uncomfortable. Okay. Just having a look. some issues such as ear infections. Okay. Have you suffered from any ear infections recently? Yeah. There does appear to be a bit of build-up of wax just inside your left ear. Be careful when trying to remove it. Don't force the wax back in the other way, because that can cause problems. Just try to gently remove it, just to save any more infections from happening. Yeah, that's good. Everything seems to look as it should do, apart from just that build-up of wax in that left ear, so again, just be careful removing that, okay? Okay, so this next test is a hearing test. I'm going to be whispering random numbers from about a half-meter distance from your ear. I just need you to close your eyes and tell me what numbers I'm talking into your ear, okay? Correct. 24. Correct. 52. Correct. 86. Correct. 49. Correct. 72. Correct. And finally, can you guess? 17. Correct. Great, your hearing does seem to be on point in terms of spoken words. My next test is another hearing test, but this time I'm gonna check your range of frequency. I've got some different sounds which create a different kind of frequency, so I'm just going to check how well you can hear both sounds, okay? Great. Mason jar. eyes now. How well did you hear that higher frequency sound? Good. So about an 8 out of 10 in terms of your ability to hear it. That's very good. That's very good. Okay, so the next one is all the way from Thailand. Wow. It is a very nice packet of green tea, which I've still not opened after all these months because I love the sound that much. But this test is just to test your lower frequency hearing, okay? Great, so close your eyes again. That's it. Okay, you can open your eyes now. And how well did you hear that sound? Oh, good, good. Okay, so your hearing and your ears are in impeccable shape, which is very good. And that will conclude this examination today. I hope you enjoyed this experience. If you did, please subscribe to our newsletter, Out in Reception, and give the nurses a like for all the hard work they do. Until next time.